The required volume of anticoagulated blood is slowly injected into the red port of the processing disposable. Once filled, the processing disposable is placed into the rotor bucket in the vertical position. The appropriate counterbalance is placed in the opposing rotor bucket. Once the lid is closed, the start button is pressed, and the centrifuge begins to accelerate. The machine is automated to perform 2 spin cycles in 14 minutes. During the first automated 4-minute spin cycle, the processing disposable sits horizontally in the rotor bucket. The floating shelf calibrates itself based on the patient's blood characteristics. The floating shelf rises to a level just below the buffy coat red blood cell interface to automatically optimize platelet recovery during the initial fractionation step. Following the separation of the plasma from the red blood cells, the centrifuge slows, allowing the platelets, growth factors, and plasma to automatically decant into the plasma chamber. When the plasma decant is complete, the centrifuge automatically accelerates, starting the 10-minute second cycle, which forms a pellet of platelet concentrate in the bottom of the plasma chamber. The centrifuge stops, and the buckets return to the vertical position. Approximately 2/3 of the platelet-poor plasma, PPP, is removed using the syringe that has yellow spacers. The plasma is aspirated into the syringe until air bubbles are seen. The platelet concentrate syringe, which has a blunt needle and no spacers, is used to withdraw the remaining plasma and platelet concentrate from the plasma chamber. The plasma and platelet concentrate is aspirated into the syringe and re-injected into the plasma chamber to mix the sample. This process is repeated until platelets are visibly resuspended in the plasma. The total volume is then withdrawn into the syringe. This creates an autologous platelet concentrate enriched with growth factors, which is now ready for application.